Good afternoon, everyone. My name is Chanel, and welcome to today's webinar. Before we begin on today's topic, here's an important announcement from Dr. Andrew Heyman.
Hi, thanks so much. This is Dr. Andrew Heyman. I'm the Director of Academic Affairs for A4M and MMI. For those of you who know me, you might also know that I wear a second hat, which is the Medical Director of Integrative Medicine at the George Washington University. In the past, we've had a structured relationship between our two organizations, and more recently, we've decided to reinvigorate that. So I wanted to announce the reestablishment of a pathway for our A4M attendees to also obtain the master's degree program in integrative medicine at George Washington University. So we're the only master's degree in the country at a major university in integrative medicine. We're housed within the Department of Health Sciences, and this master's program is a full 36 credit hour online learning program. We use the Blackboard system, which for some of you, you've also been using that within the A4M online community as well. We've done this on purpose so the environments feel very similar between the two. So all of the education that you would receive through the master's program is online. And one of the really unique distinctions that we have for those physicians in our community is that we're the only master's degree that also creates board eligibility for the new American Board of Integrative Medicine through the American Board of Physician Specialties. This is an incredible distinction and a high honor for us, that if you're looking to get an additional board certification through a formal accredited ACCME organization like the American Board of Physician Specialties, you only have a couple routes at your disposal. We're the only one that's online and a master's that leads board eligibility for the American Board of Integrative Medicine. I would, of course, also urge you to sit for the American Academy of Anti-Aging Medicine Board as well, so you could actually become double board certified. We've worked hard behind the scenes to reestablish this relationship, and the Department of Health Sciences, as they've looked at this sort of reinvigorated curriculum that we've really been working hard on at A4M, they do recognize the value of that extensive effort. And so to reward us for that hard work, we now have a functional relationship where for those of you that have either registered for at least 5 of the MMI fellowship modules or have completed them, you would be eligible to receive a 10% tuition discount in the master's degree program at GW. Now, we only have 10 slots available. So if you're thinking about signing up and you want to get that 10% discount, which is not insignificant, and you're thinking of matriculating in the fall, then I would go ahead and sign up. I'm so delighted that we now have this formal relationship again between the two organizations, and it shows you the value of the education that we've been offering through MMI and A4M and its connection back to a major institution that, for those of us who want it, could lead to board certification in integrative medicine as well. This is an enormous distinction for us, and I'm so thrilled that we have the opportunity to offer it again. The slots are going fast, so if you're interested in signing up, please contact Liz Wheeler. You can email her at A4M, and you can also call her directly, and this is her extension. She's willing to field phone calls and determine if you are eligible for the 10% discount. But as I said, we only have 10 slots for the fall, and of course, we're going to offer this every semester. But if you're thinking about it and you have the urge to, get your master's in health sciences and integrative medicine, and for those of you who want it to go on to sit for the Board of Integrative Medicine, this is our route in that regard. So I don't want to take up any more of Jim LaValle's time, but thank you for thinking about this and considering it. If you have any questions, you can also reach out to me. You can find me through A4M, but otherwise I would just reach out to Liz and let her know that you're interested as well. So thanks so much.
Excellent. Thank you, Dr. Heyman. Exciting things to come for sure. Today, we're pleased to introduce Dr. James LaValle. Dr. LaValle is an internationally known clinical pharmacist, author, and board-certified clinical nutritionist in integrative and precision medicine. In this presentation, he will be sharing with us his top natural immune boosters. He'll stop at the end of his presentation to address any questions you may have. Please feel free to submit your questions in the chat box of your control panel at any time during the presentation. Dr. LaValle, thank you for joining us today.
Great, it's great to be here. Thanks, Chanel. And I just want to real quickly thank Andy. I mean, Andy has really tried to shepherd getting legitimacy in education for integrative medicine, and this partnership they've developed between A4MMMI, which I've obviously been a part of for the last 17 years or so, for it to be associated with GW is just amazing. So great program, and I wanted to make sure we call out that hard work, because I know how much work it's been. So today we're going to go through nutrients for immune support. Then I'm also going to at least pull up the monographs and the chart that we provided for you. Probably should give another call out. One of my advanced degree pharmacists that works for me, Ernie Hawkins, instrumental in really pulling together a lot of this clinical information. If you looked at that chart and you noticed 79 tier 1 primary referee journal references on it, we plan on continuing to create robust information that's highly referenced for you to be able to rely on in your practice. So anyway, I'll get to that at the end of the talk, and we're going to make sure we have time at the end of this talk for questions. So I'm going to try and get done in about 45 minutes, because I know the questions have been really pretty strong over the last 2 weeks. So let's go through and start talking about immune function. First of all, it's this. I think this is really interesting. We talk about this all the time about a state of resiliency. State of health or disease are the expressions of the success or failure experienced of the organism in an effort to respond to adaptively to environmental challenges. I think now more than ever, it's important to understand the concept of metabolic reserve and resiliency, and that when we have comorbid conditions, the very first thing, I'm going to talk about immune supplements today, guys, but it is so important to understand. We have to get people to start changing their lifestyle, to start taking their, not over exercise, but take some exercise seriously, to try to change the way they eat, to try to really dampen their state of metaflammation or metabolic inflammation, so that their ground state or their resiliency is improved, and it allows for these agents that we're going to talk about to even work that much better. And a lot of times these agents are used as a part of the strategy to reduce that metabolic inflammatory response that's going on. So the first, defensive measures, the first one I'm going to talk about are plant sterols and sterolins. I mean, look, all plant sterols and sterolins are not created equal. Dr. Patrick Buick was the real pioneer in sterol and sterolin research, and actually was doing it on HIV patients in South Africa and the indigent population. And what they did, they kept doing studies, and they kept creating changes in the ratio of sterols to sterolins until they hit the right ratio of sterols to sterolins that impacted the immune system. The real, I think, benefit to sterols and sterolin is the fact that they're great immunomodulators. I mean, we use them all the time in cases like autoimmune thyroiditis, other autoimmune situations. A lot of times when people just have chronic inflammation in the gut. So sterols and sterolins, a really good baseline product for people to get on. It isn't something that, I'm starting to get a cold or a flu. And remember, we have to be thinking about COVID and co-infections coming this fall. This is something you want to get people on, months in advance. So, it helps in that way, not a, hey, and you're going to start taking this the day after you feel bad and it's going to kick in. Much better as a supplement for immune support. I think it's going to be very relevant the next 10 years, because this has got great studies behind it, great data, and excellent product. What's it do? It decreases pro-inflammatory cytokines, so it tends to keep your body from modulating towards pro-inflammatory cytokines too quickly, and also decreases TNF-alpha secretion, but this is over time. So once again, this to me seems like a really good maintenance or defensive strategy for individuals that are interested in immune support. There's been response in inflammatory conditions like rheumatoid arthritis and lupus and psoriasis and type 1 diabetics, people with allergic rhinitis, post-marathon running, so a real heavy-duty immune stressor. But you want to get people on this at least a month. So if you're thinking about like even if you don't want to get them on it now, if you're thinking pre-flu season, get them on it in August, because you know things start happening in September, late September. So be a good idea to get it there. What's the dose? I typically will do, there are 20 milligram capsules currently. I'm actually trying to get this company to do a 60 milligram capsule. So you just do one a day, or up to 2 a day if it's autoimmune thyroiditis. But typically you're going to be at 60 milligrams a day. You could do all 3 at one time. If you're over 200 pounds, you would want to do above 3 capsules a day, so a minimum of 4. But easily tolerated, no interaction seen. They had a warning about caution on autoimmune disorders, mainly because it has an impact on autoimmune disorders. But really, an interesting compound. Had a big impact when they, in South Africa, on the HIV population. They were seeing viral titers get drastically dropped when they were using this. And it was great because it was a low cost option for them, for the underserved in South Africa. I actually went to South Africa and discussed this with Dr. Buick and you know, learned about it. So we're pretty interesting. There's different types of mushrooms that are out there. There's people who are like, oh my gosh, can we use mushrooms if they're stimulating to the immune system? Like, there's a lot of mushrooms that are immunomodulating. So for example, cordyceps and shiitake. I mean, shiitake tends to kick out killer cells and NK killer cells, but in general, mushrooms tend to be more immunomodulatory. Even though you may see in a certain individual, when you give a mushroom, it stimulates their immune system, is typically because it's modulating the immune system back in a different direction. But probably if you're going to pick from I'd say the single best mushroom extract, and in terms of COVID, I would be looking at Cordyceps sinensis or Cordyceps militaris. If you see that, it's the second herb. Typically, the dose on Cordyceps, if you're talking about someone with COPD, which is what they use it for in traditional Chinese medicine, and it's 3,000 milligrams a day for someone that's immunocompromised. And then if you are just a healthy person, and maybe you're living an active lifestyle, and maybe you're exercising, and you want to get the benefits of a 9 to 13% increase in VO2 max, in addition to improving oxygenation on your red blood cells, improving your respiration, you know, you can get by at 2,000 milligrams a day. And there's even studies showing for just the athletic benefit or the improvement on lactate threshold at 1,000 milligrams a day. So if I was going to pick the one herb out of this, I'd probably start there, specific for COVID-19. I would say if you want, you know, who's number 2? Probably reishi. Reishi is a really good immunomodulating agent. And then from there, the other of these all have value, but I just kind of want to give you a list of the different ones that are available. This one happened to be a combination product. And of course, we could talk about a million ingredients, right? Beta glucans could be important and are important, right? Because they're another one that helps the immune system. The next, of course, that nobody's talking about, everybody's talking about vitamin D, but they're not talking about vitamin A. I provided a vitamin A monograph for you guys. I am going to pull those monographs up because we are going to be supplying those monographs. There's going to be you know, monographs that are available through A4M, and Dr. Heyman's working on that through the lifestyle portal. So we've got 240 monographs, all on natural compounds, all written at the quality that you'll see with the, you know, what you saw with the vitamin A and the peptides and the Thai ginseng. So why vitamin A so important? It's obvious. It's so important. One, it helps with the microbiome, which a lot of people don't realize. You need A, everybody thinks D, but remember, vitamin D is a retinoic acid receptor activation. And so you'll have people that you give vitamin D, it doesn't go up. A lot of times it's because they're deficient in A and they need vitamin A in order to make that work. And then there were all these concerns about birth defects that occurred on vitamin A. That's all been disproven. I go over that in the monographs, and we actually cite the studies that justify that. So really, and the next thing it's really important at is that mucosal barrier, that it really helps with epithelial cell integrity, mucosal cell integrity, and immune response for the mucosal cell. So it responds to a virus. Obviously it's important for response to viruses. And just remember, really on that cellular immunity, incredibly important. So if you look here, what is it depleted by? So you've got aminoglycosides, bile acid sequestrants, and colchicine. So 3 different drug categories. You don't see colchicine or aminoglycosides being used, preventatively or on a regular basis all that often. But the bile acid sequestrants, of course, are being used more and more in the kind of biotoxin world, right? Where you're using them for detoxification, sometimes, weeks, months on end, and their vitamin A levels could be low. And remember, you want to get retinol palmitate. Don't rely on beta carotene to be transformed into vitamin A. So when you're looking on your bottle of an agent, it should at least say, hopefully, from 80% retinol palmitate, 20%, natural carotenoids, way better than the synthetic beta carotene, of course. Dosing, look, in pregnant women, 10,000 units a day is the max. Typically, you like to count them up, but if people are in the prevention mode right now, antiviral potential, I'm giving people 15 to 25,000 units a day of retinol activity from their vitamin A. And this is the 2020 guides for healthcare professionals from the NIH. So this is straight from the NIH guidelines, guys. Just recently published April 2020. Like I said, we're going to be up to date and giving you guys the best info possible. Zinc, look, it's obvious. Everybody's talking about the zinc transporter and its effect on COVID. I think that it's important. Look, if you want, you can get a red blood cell zinc status in someone's blood test. In men, you could easily look at their estrone and DHT, and if their estrone's going up and their DHT is going up and you can see their testosterone's converting, that's a good sign their zinc is probably low. And it's obviously an essential micronutrient, and probably one of the most important aspects of zinc is that it is a modulator NF-kappa B. So, we're always looking, especially in this COVID event, things that will modulate the explosion of inflammatory cytokines and that inflammation cascade within the cell. And so zinc deficiency will lead to a lack of modulation and both the oxidative stress burst that occurs within the cell and also the inflammatory cycle that goes within the cell. And it leads to cell-mediated immune dysfunctions. Obviously, they've even looked at zinc deficiency as it relates to autoimmune thyroiditis, and they've shown that there's an association there. Also, in terms of chronic inflammatory conditions, I would say you could note the studies on the gut and how zinc supplementation over a period of 30 days dramatically reduced gut permeability and improved antigen presenting cell activity. So these are all kind of things you want to be thinking about with zinc, not just for the fact that, oh my God, I'm worried about a virus, but it's how do I keep my immune system intact, maintain my resiliency, and maintain my metabolic reserve and reduce that risk of low-grade metabolic inflammation that makes me more vulnerable for things like COVID and flus and other vectors that attack us, right? Adjunct on mortality in pneumonia, 6 randomized double-blind placebo-controlled trial on 2,216 patients with severe pneumonia. Zinc treatment as an adjunct to antibiotic treatment significantly reduced the mortality, had no treatment and no change in treatment failure. This was a 2008 study. So yeah, we should be doing zinc, guys. It's an obvious one. There's another one in autoimmunity For all models in autoimmunity that were studied in the 62 studies in the database review, zinc concentrations in serum autoimmune patients were significantly lower than controls. And remember, we're not getting the kind of trace minerals we used to in our food. So it's harder and harder for people to get adequate zinc status, adequate vitamin A status, adequate magnesium status. These are things that are challenges for us today because food quality isn't as good as it used to be. Dosing, look, you can go to 100 milligram burst if you want, even in the gut models that were done at 200 milligrams a day for 30 days, and then it was discontinued. But, doing 100 milligrams a day, no problem. Just remember, it can alter iron and copper absorption. So, you may want to just make sure if you're taking a multi that's got, zinc and copper in it, that's fine. And then you maybe add another 50 milligrams of zinc as a maintenance. So once again, we're talking about preventative. So you can go around 50 milligrams. That'll also help that estrone and DHT issue. The other big one, quercetin, obviously has some big antiviral effect and anti-inflammatory effect. It downregulates histaminic response. It is immunosupportive. It obviously upregulates the SIRT1 pathway. Excellent in terms of that. Western diets typically only have 14 milligrams of quercetin a day. Clearly not enough. And if we look here, it's not too early. It's about 2016 study. So what are the baselines on this? It's cardioprotective, it's neuroprotective. So we know when we upregulate SIRT1, we're going to help out the neuroinflammatory response. It decreases nitric oxide synthase and COX-2 and CRP and lipoxygenase. So it's having an effect on those downstream inflammatory markers. And then it also has some other important pieces to it where it's improving lipid derangements, and that makes sense just from the standpoint it's anti-inflammatory, right? The more inflammatory a person, the more dyslipidemic they get, the more they make ox-LDL, the more they make apolipoprotein B, the more their LPA goes up, the more they trigger their myeloperoxidase and their fibrinogen, right? So it makes sense that quercetin would have a positive effect in that area. But getting back to viruses, it's been shown to respond to quite a few, viruses respond to quercetin therapy, right? So this was a study back in 2005 that kind of showed all the various viruses: herpes simplex, encephalitis virus, the Zika virus, Ebola virus, adenovirus, H1N1, H5N1 avian. So obviously broad ranging, I think, preventative effect on individuals. When you look here, disrupting HIV latency, interacts with viral hemagglutinin, great, it activates viral NS3 protease, and once again, upregulates SIRT1 and SIRT2, and that, of course, has a very significant effect on restricting that viral infection and then the viral spread. So 500 milligrams 3 times a day. I do up to 1,000 milligrams 4 times a day. If I'm dealing with a runaway eczema case, I even go up to 8,000 milligrams a day. I mean, I've dosed people heavy for 5 days to shut down their histaminic response. But if you're just doing this preventatively, 500 milligrams up to 3 times a day is enough. Thymus gland extracts. So obviously we're going to talk about TA1 in a little bit, but I've used thymus gland extracts from New Zealand for a long time, and they've always proven out to be really well for me when people begin to get a cold or a flu or they feel something coming on, a viral load coming on. I've got a herpes outbreak coming. I hit them with some thymus extract, and it works really well. The reason I choose New Zealand gland extracts is because they're veterinarian extracted and they're medical grade. So they're processed as a freeze-dried lyophilized gland, and so that holds on to all of the peptides and signaling substances through the lyophilization in the freeze-dry method versus a heat method, which would denature peptides. So typical dose, 750 milligrams a day. I've gone up higher if someone's getting more intense symptoms. I'll easily have them do 6 a day of a 250 milligram capsule. Once again, interesting here. Thymus, forgotten but important organ, Advanced Clinical Experiential Medicine 2016, and the Thymus Neuroendocrine Axis, New York Academy of Sciences. We're finding out that these gland extracts end up having, some interesting signal substances in them. So I think it's, timely. Now, you've been diagnosed. This is relatively new. I don't know how many of you guys may know. I know you know nicotinamide riboside. It's been around, but they're actually doing some studies with it as it relates to COVID, and it's interesting because it upregulates NAD levels, right? And when you're upregulating NAD levels, how does it do it? It does it through what's called the salvage pathway, right? Because as you get older, you're not as efficient at using niacin. And so this is going to improve mitochondrial energy production, which means it's going to, support being resilient and having repair. I had a gentleman on the phone yesterday, a mold Lyme case that we're kind of 3/4 of the way through it. I gave him Niagen, and he's like, I can't believe how much energy I've got now. Well, it makes sense because he was so mitochondrially damaged from, what the struggles he had already had with his biotoxin and Lyme situation. It is neuroprotective. This is interesting in that it has a key role in innate immune response. They're actually studying this now. I believe the NIH has got 2 studies going on with this. So where this actually works, so if you look at as you get an infection or an inflammation, you upregulate the polyadenose diphosphate ribose polymerases, so the PARPs. Those they use up all the NAD. So when they get activated post-viral infection, your NAD levels plummet. All right. And so using nicotinamide riboside, one, makes sense preventatively, keep your NAD level high in your cells, but also have it going on ongoing. If you do get a viral load, you want to have nicotinamide riboside on board up to 1,000 milligrams a day. Their last study they did showed was, between 300 and 1,000 milligrams a day showed benefit. See if I can get that to move over a little bit. Let me get this down here. Hold on one second. Here we go. So if we look at the infected group here, take a look at their NAD levels as they drop post-infection. So this was back in 2012. And let's take a look here. And then NAD depletion addresses questions from the infection. This is NAD-dependent enzymes play a key role in all stages of COVID-19. Here's the thing. What they're trying to theorize is that if we can get the NAD levels up and the mitochondria can keep producing energy, there could be a reduction in the staging or the deep damage that occurs in tissues post-event. So this isn't looked at as, oh, this is going to cure COVID-19. I want to be clear about that. But it is interesting that it could be a very important salvage mechanism, particularly with lung tissue. So interesting. So once again, supports neuronal NAD synthesis without inhibiting sirtuins. Rate limiting co-substrate for sirtuin enzymes and regulates sirtuins, which of course is important in this whole process right now. But the actual piece that's interesting that's being studied is as viral load goes up, PARPs get activated, NAD gets sucked out of your tissues, right? You're losing your mitochondrial capacity. When you do that, you trigger that cytokine storm. So keeping that nicotinamide riboside on board to keep fueling through the salvage pathway, to keep fueling the NAD could be really interesting. Another one, Andrographis. I love Andrographis. It's one of my favorite botanicals. It's another immunomodulator and helps with Th17 expression. Andrographis is an antiviral, probably is one of the more well-studied agents versus flu. And so, Andrographis is fantastic. Dosing at 300 milligrams twice a day. If you look at the standardization of 10 to 50% andrographolides, I'll give up to 4 times a day if people were coming down with something. I'll dose them every 4 hours while awake. If you haven't been using Andrographis, you should check it out. It's, I think, one of the more premier herbs to fight viruses that are out there. And it does it from an immune modulation perspective. And this is a 2010 randomized double-blind placebo-controlled trial in an upper respiratory tract infection. This was only at 200 milligrams a day. Symptom score versus placebo was 2.1 times more effective. I actually wrote a book called Green Immunity, a little tiny little paperback. That this was one of the 3 herbs that I focused on because the value of it was so clear, even for post-viral syndrome. Better than Tamiflu. So really a great herb. Autoimmune associated fatigue. This is a 2016 study, so 12-month double-blind placebo-controlled on MS patients, given 340 milligrams a day, and their fatigue score dramatically improved. I think this is going to be a really important post-infection herb for people to help them get back their vitality and their energy. And then we've got Thai ginseng, and we're going to be good on time. Good. We have Thai ginseng or black ginger. Finding that a high enough concentration of the 5,7-dimethoxyflavones, that's kind of important for this one. It has been shown to improve mitochondrial biogenesis. So once again, SIRT1 upregulation, protect the NAD, help manage that PARP escalation that occurs during a virus break. And it has 3 to 4 times the effect of SIRT1 upregulation of resveratrol. And so sirtuin's obviously, the topic of discussion for evolutionary viral restriction factor, so it acts as an antiviral. It inhibits viral proteases. So it has strong activity against H5N1. And then it, I would say it upregulates TNF alpha, which everybody goes, oh my God, you can't do that with this. Remember, it acts in an immunomodulating way. So it may do that at the initial onset, but it's balancing out immune function as an immunomodulator. And it's active against cytokine storm. So if you see the bottom, which is the big issue that we're talking about, is we're concerned about cytokine storms. This was a Asian Pacific and Journal of Tropical Medicine 2017 study, which showed that it had activity against that cytokine storm that goes on. So Thai ginseng, I think is another newcomer. I'm trying to give you guys some new herbs that are out there, as many of you have become accustomed to what I'm trying to get to you. Can help with weight management. It has some PD5 inhibiting activity, so it helps with nitric oxide, which I think also is a secondary benefit in terms of this whole infectious issue. And then there's some thought that it might help with stress and performance. But for our thoughts today, it's about that management of the cytokine storm. If you look at the dosing, typically it's 100 milligrams a day of a 4% dimethoxyflavone. If you're already giving PDE5 inhibitors, then probably, maybe a little caution on that. And it can affect the cytochrome P450 mechanisms in phase 1 detoxification. I also listed all the drugs that you may want to just at least have caution with, although no studies have been shown on this. But just as a point of caution, here's some potential interactions that are in it. And obviously you have these slides that you can refer to. It's probably one of my favorite herbs that you can use for people with upper respiratory heavy mucus production. Get them on this early. If you're not using Hedera helix or English ivy extract, probably one of the most popular agents that you can use in Europe, recommended by docs all the time. I've recommended this for a good, I don't know, 10, 15 years. I know I've taught about it some. Many of you probably use it. But it's a Commission E monographed approved herb for relief of chronic upper respiratory inflammation. It acts as an antispasmodic, and I've seen it help barking, spasmodic, mucus coughs, as well as any drug I've ever seen. This is probably the single best cough and mucolytic thinning of the mucus agent that I've seen. It activates the mucus glands and bronchi through parasympathetic signaling. So what's that going to do? Help with respiration. In 2009, showed almost 10,000 patients and 5,181 children with bronchitis, acute or chronic bronchial inflammatory disease treated with IV syrup at 11% Hedera seroticicides. And so if you showed the dosing here, 95% of the patients showed improvement of their symptoms. 2.1% showed side effects, of which 1.5% were transient GI. And then some patients got antibiotics as well with no apparent benefit respective to the efficacy, but there was a 26% increase in side effects when they got the antibiotics. So if you're trying to help out that early cough, I don't care whether it's just going into cold and flu season, you're dealing with children that are, have cough and cold. This is one that a child can get. Remember, we're really kind of hamstrung on what we can give children on cough and cold these days. English IV extract, really amazing. Another study here on 17,000 patients. I'm sorry, I'm getting small studies for you guys on herbs since there's no evidence, right? Conclusion here, IV was effective in reducing symptoms of upper respiratory tract, including duration of cough and improvement in mucus. Teaspoon to 2 teaspoons, 3 to 4 times a day. This was a 97 study. This study here was a 2009 study. Only about 26,000 patients between the two. This is brand new here. You probably have not heard of Pelargonium sidoides. And this is African geranium, high levels of polyphenols. It's got strong antiviral effects. It seems to upregulate nitric oxide, helps with NK cell activity, and is cytoprotective against the virus-induced cell destruction. So it helps to protect against that viral spike entering that cell membrane and triggering an inflammatory response. And once again, if you look here, it's immunomodulating. It can upregulate or downregulate TNF alpha depending on the environment of the cell. Increases the release of defensins, which is obviously at best. And here's one of the most interesting things about this, why I added it. It stimulates ciliary BISP frequency in respiratory cells, so it keeps ciliary movement in the respiratory cells intact and improves respiratory cell vitality. So most of the clinical studies are with a proprietary extract called EPS 7630, which once again, I'm big on trying to get you to understand. You got to find the extracts that are actually being utilized in the studies. And this is just kind of what it's doing. It's downregulating the reactive oxygen species. It's helping to manage the cytokine network and modulate the cytokine network. So once again, immunomodulatory in nature. Clinical evidence here. This is the Cochrane database. If you guys are familiar with the Cochrane database, probably one of the most rigid databases for making any kind of claim. This showed that it may be effective in alleviating symptoms of acute rhinosinusitis as well as common cold for adults in a 2008 meta-analysis of 6 reports. Whoop, my bad. That it helps patients with bronchitis on a 7-day treatment, reduce severity and duration of bronchial symptoms over placebo. These are 2008, 13, and 15 studies. And then cough in 2003, double-blind randomized control on 143 children. Once again, looking for those kid issues. 6 days on, 80% of the treated returned to school versus 21% on placebo. Side effect, nasal irritation, common colds. Multiple studies show that it's tolerated for common colds and you get a dramatic benefit. Are these cures? No. Do they improve the time to back to function? Absolutely. We also have a couple things here on the peptide front. A lot of you have taken peptides. So one, or have taken the course of peptides. I provided from our handbook that's going to be published soon is the thymosin alpha-1 and thymosin beta-4. Why we're recommending thymosin alpha-1? Because it's immunomodulator. It has a pleiotropic effect, meaning that it helps to support how the expression of the immune system occurs. And it helps modulate the gut mucosal system as well. So, not only thinking about how am I going to defend against a flu bug or a cold bug, but in all these autoimmune behaviors where people are having trouble with their gut mucosal system. Yeah, BPC 157, awesome. We understand that, but a lot of people sometimes don't think of thymosin alpha-1 is something that really turns the tide on their histaminergic activity. And, this is basically just showing the net effect of thymosin alpha-1. If we drop down to the bottom, we see a downregulation of IL-1 beta, TNF alpha. Cytokine receptors become more sensitive. We get an increase in IL-2, a downregulation of IL-4, 10, IL-1 beta, and TNF alpha, which of course are going to create that cytokine storm. We get better stem cell differentiation. We get better natural killer cell activation. So this is obviously a go-to. I know a lot of docs have been pumping through a lot of TA1 for their patients during this time. 3,000 patients, 70 clinical trials for immune support, used in conjunction with vaccines to support immunity. Dosage typically 0.15 mLs at 3,000 mics per ml daily. I mean, it's been taught in the courses at A4M up to even 0.1 or 10 units twice a day. Can also be used. Transit increase in ALT can occur. One of the things you'll notice on the peptide handbook monographs that we put in is that we added a section for potential side effects. Thymosin beta-4. Once again, originally I isolated from calf thymus. That's why I talked about thymus extract, the whole gland. Helps decrease scar tissue formation, helps with immunity, improves T killer cells, can be used with thymosin alpha-1. Once again, helps with the human gut mucosal immune system. Summary here is, where is it utilized? If you look at the anti-inflammatory effect on the far right, we see that NF-kappa B, endotoxin lethality goes down, inflammatory cytokines go down. So I think this is an interesting piece, as well as regulation of metalloproteinases and having an antimicrobial, obviously antiviral effect. So interesting and significant compound. Let's hope peptides keep growing in their value and we keep collecting the data on them that we need to. Application, obviously soft tissue repair, tendons, ligaments, pressured venous stasis ulcers. Use it for immune system with TA1. You've seen it for kidney support. It's been, there's been some interesting papers on kidney. And then of course, ischemic stroke. And then decreases endotoxemia, an area I've lectured on a lot. If you've heard any of my lectures on endotoxin over the last 15 years, incredibly important that we realize that endotoxemia drives multi-organ failure in people. So the more we can reduce that endotoxemia storm that occurs, the better off we'll be in these acute situations. Dosing, up to 300 mics a day. Depending on the presentation, so you can use it with thymosin alpha-1 and BPC concurrently. Obviously other supportive plans, if you're talking about defenses, hydrate well, please get people to eat well and not think it's an excuse to drink more in our quarantine. I know it's tough on everybody. Get people to move around. And that's basically it. I want to be able to show you real quickly. This is just kind of an example of some of the things that we're providing. You should have gotten this peptide monograph. We put a team of people together to write on peptides. If you notice, we put together warnings and cautions, put together dosing. We have it listed, obviously explain mechanisms of action, and then obviously provide the you know, the referencing that all of you are looking for as it relates to a thought for a peptide. And then I did the same thing. I thought we would show this to you as well. And this is going to be available for all of you at A4M. So this is a same thing. What's it used for? What's the dosage? What's the warnings and cautions? Where's the summary of what it does? And then, of course, the most important things of where it works, how it works, and then the references that are supportive for it. And then we also, you guys should have gotten our monographs, which once again, we're going to have a full library that's through the lifestyle portal for A4M that we're working on. And this just kind of goes through and explains for you, hey, here's the actions real quick, not a 20-page monograph. I've written plenty of those. These are basically to give you a quick summary, a real quick hit. Where's the dosage? Where's the caution? What are we, well, you know, why am I going to give this? So if you want to look up Pelargonium, or you want to look up English ivy, or you want to look up, hey, I want to see some latest stuff on vitamin D. You know, we've got 240 of these monographs on vitamins, minerals, herbs, and nutraceuticals. And now we've got a full monograph guide on peptides as well, at least for the top 25, not certainly not a lot of experimental ones. And so this just kind of gives you an idea of what we're doing. Along with that, here's a patient snapshot. So when you think of this, this tells the patient what they want to know about it. So it gives you something and the patient something. And of course, we, as you well know, you know, we're very well referenced in terms of our comments and statements as it relates to a dietary supplement. I always laugh when they tell me there's no evidence. I always seem to be able to put 50 references on a document. Last but not least, then we'll do questions. I'll get us done here, so we've got plenty of time for questions. Well, we've got two. Thai ginseng, good example here of what we do with the botanicals. I think we sent this out to you as well, so you can kind of read up on Thai ginseng. I know it's something probably relatively new for you. Side effects, warnings, what it's standardized to, all those types of things are included in this. And then, of course, the, oh, I don't know, 53 references on Kaempferia parviflora. So, you know, trying to be thorough. The last is we were asked to put together, in conjunction with A4M, this nice little chart for you guys. And I'm just going to tell you, this is not meant to be every last immune product that's available on the market. We tried to put together some of the big hitters. You know, for example, there was concern on, well, is Sambucol more pro-inflammatory and might actually cause problems in people? Well, there's actually studies that show that it's immunomodulatory and reduces cytokine storms. So trying to kind of get the mystery out and get the studies that are published on these things into the information. I hope you guys found this to be helpful, and I hope you use it. We're trying to really give you guys information that can be of value to you. And once again, I just want to, you know, thank Ernie, Dr. Heyman, Sahar, the whole staff. We really came together and put this together. Ernie Hawkins leading the charge for us on this, but as a group effort to review it and really make sure everything was right. And I just want to go down once again. This will have has a couple of the peptides in it. It's got the herbs that we talked about in it today, along with others. I do want to emphasize again about I think 79 references on this little chart. So we hope you find this to be useful. So that's all I got, guys. Glad to take on some questions. I know we got about 10 minutes, and we can go from there.
Thank you, Dr. LaValle, for your insight on this topic. Like you said, let's take a few questions that have come in. What is the role of HEM, which has been used for immune support?
Of what? Hemo what?
Hemohim, Hemohin.
Wow.
Not sure if that's a typo.
I think it might be. I'm looking it up. I haven't heard of that, so I don't know.
It's, I guess, something that was used in South Korea. While you, I guess, look up that information, I'll at least ask the next one, and we can just make a note of that one.
Yeah, I honestly, I have no idea if it's a South Korean, agent that they're using. That's well, we'd have to look it up, and we can get back to you on it and kind of look at all the data on it and see how strong it is. But I did a search on it just now if it's spelled that way, and I'm not getting anything. So go to the next question.
Likely a typo.
Sorry.
What brand of?
Oh, sorry, Chanel. Just a minute. I was on mute and I was talking away. But so it looks like it's an immunomodulatory. So they're using it in cisplatin type toxicity, Jim. And it's immunomodulatory. So it looks like it works on interferon, interleukin B kind of immunomodulator. Just
Hemohin.
HIM as in Mary. So hemo, HEMOHIM.
There we go.
Yeah.
Perfect. All right. Good. Well, that makes sense. Another immunomodulator. There's a bunch of them. So let's go ahead and hit the next question.
Next question. What brand of sterol or sterolin do you use?
The only one I use is Moducare because it's the only one that's the 100-to-1 ratio, and it's that's a patented extraction for it. So there's a lot of different sterols out there, but if it's not in that 100-to-1 ratio of sterols to sterol glucosides, a sterolin, you have a plant fat and a plant fat with a sugar moiety on it. That's a sterol glucoside. So yeah, you want that. That's Moducare, Moducare. I got a picture of it in the chart here for you if you guys want it. Oh, there it is, Hemohin. Got it.
Where can we get the plant sterols?
Plant sterols? I mean, you can order those through Wakunaga of North America. Wakunaga. You can go to Kyolic's website, KYOLIC.
And could you please repeat the doses for vitamin A?
I mean, if you're just at maintenance, just think about around 5,000 units a day. Pregnancy for women, don't go above 10,000 units a day. If you're being more aggressive, to start to preload them with vitamin A because you suspect a vitamin A deficiency, you can do 25,000 units a day. I know there's some people that have done things like big dose vitamin A for short bursts of time, antiviral, like 100,000 units for 5 days. I don't recommend that because I've had a couple people over the years that had problems with that. So I just never have gone there. I just try to titrate them at somewhere between 10 and 25,000 units a day, especially if they're going into flu season.
Yeah, and just
What is your recommend?
Just to add to that, like with the really high doses, because we've seen those, especially people with granulomatous, I can't talk today, disorders that can really worsen the disease, because we've seen that. Exactly. They'll use the 100,000 plus, and right now that's rampant. So just be careful, especially with selection of that. I'll
be a little more clear because I think I said it. I don't recommend the 100,000 unit dose a day because of those problems. So you should build your vitamin A up at moderate dosing, just to be ultra clear. And it's even on here. I just got it up here. If you notice here, guys, I've got your dosing right here on the chart that we provided for you. Okay.
And for those who are asking, these charts are available on our website at www.a4m.com. Once again, they are under our COVID-19 resource hub. And if you click on practitioner handout, you'll be able to find these there. There are some documents that aren't available as yet, but those will be up shortly.
Great.
Our next question, what is your recommendation for supplements for patients with mold toxicity?
Oh my gosh, that's a whole different discussion. But if you're gonna I work with Andy is my medical director here in California, and he and I work together a lot. So I mean, obviously, if you're not going to use Welcol and you're not going to use cholestyramine, okra makes a lot of sense. So, making sure you're doing okra as a binder is important. And then I like using things that clear the gallbladder out. And so in particular, I like artichoke extracts with choline. So, that phospholipids that you take are great for your brain and help repair the brain in terms of the cell membrane, but it also is really good in terms of helping the gallbladder as well. I mean, I also use homeopathy, so I'll use homeopathic mycotoxins, things like corn smut and rye smut in a homeopathic dilution, much like an allergy, titration. I'll use those. So things like Sakali cornatum. I also will use homeopathic belladonna. And then I also work on things like getting their histamine response down. So I'll use ABP1 to upregulate their diamine oxidase. Use quercetin. Those are some of the more common things I'll do, but I'm always looking at what else do we have to add to complete the equation for people.
Well, the problem with these patients is that if they have the presence of certain HLA sequences on chromosome 6, it means they have a very inefficient handoff between the innate immune system and the adaptive. It pegs them into that early innate immune response that's persistent, and they get, quote, the cytokine storm. It's essentially the same storm that the virus induces, except the storm from the virus is just much bigger. So functionally then, your best option in the meantime, if they're not progressed down the path of therapy, is to try and facilitate the progression from innate to adaptive. And how do you do that? Well, thymic protein extract orally and TA1, because those have both been shown to improve antigen presenting cell efficiency, which really that's where the inherited defect is. So if you're looking for sort of a strategy to help produce antibodies and create a robust adaptive immune response, especially in that population, I would start thinking about thymus related products.
Next question. Would TB4 be useful with sarcoidosis?
Sarcoidosis, yeah. I don't have any experience with it on sarcoidosis. I would think that it would be, as it's really good at restoring kind of the fibrotic scarring that occurs in kidneys. So I'm thinking that it would have value, but I do not have experience at giving TB4 in sarcoidosis case versus giving it in CKD cases and other situations, joint pain, connective tissue, lots of, we've done it a lot here. But I would think it would have value.
Thoughts on elderberry for immune support?
Once again, I tend to use elderberry once people start to have an issue. Remember, there is evidence that it's immunomodulatory. Everybody was thinking, oh my God, it causes oxidative burst. It's going to contribute to the cytokine storm. There's research that says that it actually immunomodulates immune response in endothelial cells and other tissues. And I actually included that in the references for elderberry. So it's great. Remember, it's coating that virus. So when you coat the virus, you're downregulating furin expression. When I downregulate furin expression, the spike from the virus doesn't, break in half and activate your cellular inflammatory mechanism. So, you're looking for those things that kind of modulate that cell penetration, and that's what elderberry does. I mean, that's what it's proven to do in flu bugs, not in COVID-19. So once again, we're applying a rationale, hoping that it has the same effect. But I don't give elderberry preventatively. I'm more on the cordyceps, thymus extract, TA1, vitamin A, and Magicare. those are my, like what I'm using here, that's the stuff that I'm using. On the preventative side, when people call into the office and want like a regimen. So I kind of plan which of those I'm going to give them based on their situation. So I keep elderberry in my holster for when it gets active, just like English ivy with guys. English ivy is amazing. I think I made it evident in my talk, but yeah.
Have you seen local site irritation with Thymus in A1?
Absolutely. Yes, I think it's listed in the side effect on the handbook that we wrote, is that you can get local irritation and histaminic responses on it. I try to people sometimes to chill it first, you know, just kind of cool off, put a little ice cube on it first before you inject. Maybe try that. Disperse it a little bit right after the injection. Try that. Obviously, if they're having a really strong histaminic response, don't try it again. But yeah, I've seen local irritation.
Can you share the brand of thymus gland extract recommended and also the brand of the Andrographis?
Sure. On Thymus, I use PHP because it's a New Zealand gland, so Professional Health Products. And on Andrographis, Planetary Formulas has an Andrographis. There's several on the market. There's not a lot in the professional channel with Andrographis. I'm actually, due to all this, I'm formulating one right now. So we'll post something by the end of our 8 weeks. We'll give you if you guys would like it, I'll list brands on all this stuff for you and make a chart of brands if that's something all of you would find useful. We'll be glad to help with that.
What is the evidence for using IV vitamin C, or what can you give a COVID patient coming to the ER who may have hypoxia?
Oh my gosh, I'm not qualified to answer that, although I've had a lot of discussions regarding IV vitamin C, thinking about sodium bicarb to alkalinize the intracellular space so that we reduce the amount of acidotic behavior and cytokine storm. I think I was talking with an ER doc the other day that they're talking about how, you know, a lot of these patients that are presenting are coming in and you know, they're trying to shove too much, you know, put the ventilator up too high and you know, it's like trying to, you know, shove oxygen into heavy water. It's like it's got to be dialed way down. So I mean, I think glutathione is something that could be a benefit. I think the rationale for vitamin C makes sense. But I'm going to leave that to my ER colleagues and docs that are in the front line. But you know, I've certainly been discussing this with folks on looking at where the rationale is and why. I think the bicarb is interesting myself. I think it makes a lot of sense.
Is there a role for low-dose naltrexone in viral illnesses?
Well, I'll tell you what, if you listen to Dr. Zell, David, I think it absolutely has a role. And I think it could play an invaluable role as an immunomodulator. So I think LDN's, you know, really interesting. And Sahar, I mean, Sahar, you can jump in on this. You're the LDN expert. I mean, I think I personally think it's got a lot of value.
Yeah, yeah, and they're actually doing a couple trials with it also.
Right.
You know, to look at that specifically, but it's very interesting because with this COVID-19 too, we see, you know, upregulation of these inflammatory peptides, but also IL-17 and Th17, which LDN is really good at modulating Th1 and Th2, but also most importantly, Th17 too. So, and that's why really the scientific logic behind it. So it makes absolutely common sense, especially in these higher risk patients, which is, you know, the risk factors associated, no surprise to any of us, you know, inflammatory states. Those are the patients that are faring worse with COVID-19, and something like LDN in a lot of these immunomodulatory herbs that Jim just covered would be perfect and great. But LDN is interesting because of its more actions on, you know, Th17 too, which is definitely one of the players in this.
Yep.
And what was the product that you mentioned for Montecare?
The product for Montecare? Montecare is the Sterol and Sterolin product.
I'm sorry, repeat that, please.
Montecare is the Sterol and Sterolin product.
Thank you.
So that's made by If they're asking about the manufacturer, it's Wakunaga. They're a Japanese pharmaceutical company actually that actually makes. They also have offices here and actually growing fields in the United States. They could look under the brand Kyolic.com if they want to look up Montecare.
And where do you get the English ivy and the Pelargonium?
Pelargonium, I'm gonna send that out to you guys because I'm searching out who I trust on that. But English ivy, so there's a couple ways you can do it. If you're just gonna send mom into the pharmacy to pick it up, it's actually, if you guys have seen Zarbee's, Zarbees cough syrup, the main ingredient is English ivy syrup. So it's actually at the local pharmacy now in a big way. And then if you are going to go like to ITI or Phytopharmaca, they have a straight English ivy syrup that you could get. Either stock it yourself or send people to the local health food store and they can get English ivy syrup from Phytopharmaca or ITI.
What do you think about using curcuma longa for improving the immune system?
Once again, I mean, I could name 100 herbs. I mean, I could have just spent a whole day talking about herbs for the immune system. I think curcumin's interesting once again, it downregulates NF-kappa B expression. I mean, it's known to downregulate the genetic expression of NF-kappa B. So it's a good herb. Do I think it's the big herb to use in this case? No, I'm looking more at things like cordyceps, which are immunomodulating, have an effect on Th17, have an effect as a lung supportive mechanism. I think it's more targeted for the situation. But do I have anything against curcumin or boswellia? No, great herbs. Really good. Both act as, boswellia acting more on the complement side of the immune system. Either one of those are fine if that's what you want to do. It's just, I try to pick things that were really kind of specific for our COVID discussion. So, but curcumin's good. Yeah. Obviously, if you get the right ones.
Excellent. And our last question for today. Do you think we develop protective immunity for COVID, and about how long do the antibodies last?
Let's leave that to the public health officials. Andy, you want to try to tackle that one yet? I don't think the data is real clear on any of that.
So Andy left, but so actually I was just listening to a testing webinar just last evening, and I have one at 2 o'clock actually that I'm talking to an immunologist from Stanford. So if I as I learn more too, I'll let you know what I learned from this immunologist. Yeah. Stanford at 2 o'clock, but so yesterday, nobody really knows. So the bottom line is nobody knows, including all the brain across the country. But now that's also what I learned, which was interesting, and I didn't know this, is there's the difference between just antibodies and neutralizing antibodies. Well, I knew that part, but the point is, we think the neutralizing antibodies are the ones that are going to be obviously better at neutralizing and more effective at, neutralizing the virus on re-exposures. The part that these testing and a lot of these tests are showing, because they're not grown in viral cultures, there's just viral RNA. And so that's one part of the test. We don't know if people even test positive. Are they infectious, or is it just the viral RNA that's present in these asymptomatic people like we're seeing? And are they infectious? We don't know the answer yet, she said. This is an immunologist from last night. The other thing is the antibodies. So even if you test positive, we really don't know if these are the neutralizing antibodies, and therefore, because the other antibodies are not as protective, and these may be protective, and usually for shorter terms from prior coronaviruses, not specifically COVID-19. So that's what I learned from the one yesterday, last evening, literally, and I hope to learn a little more at 2 p.m. that I can share maybe next week.
Yeah, and I think the only reason right now is that if you're going to test, the only accurate test that really kind of does it is the quantitative antibody test, which is, companies like Access Labs are the ones that have that kind of specificity. So that's, all this is evolving. So I hope this gave you guys some insight. Please let me know if you want me to put together the list. I can add it as another resource for you guys if you want some vendor stuff on these things. I'll be more than happy to do that for you. And I hope you got some value out of this and find the handouts that we spent a lot of time putting together for you all to be beneficial for you.
Thank you, Jim. That was great.